It's my pleasure to present this work on behalf of my group and my team of co-investigators. We have investigated the role of add-on Parsaclisib in patients with myelofibrosis who have manifested suboptimal response to Ruxolitinib. So Ruxolitinib has been a standard of care for the last 10 years in patients with myelofibrosis. And despite the great clinical benefit that most patients manifest, there is a proportion of patients who manifest suboptimal response, and we believe that part of that suboptimal response is due to escape signaling through PI3K pathway. The co-inhibition of JAK1, JAK2 by Ruxolitinib and PI3K pathway by Parsaclisib made a logical rationale biological rationale in combination to achieve a high clinical response. We've designed this add-on approach as a phase 2 study with 2 different dosing schedules, and we presented this data previously in the European Hematology Association, and this year we present the updated results, which seem to be concordant with effectiveness and persistent response. So in patients with already maximized therapy with Ruxolitinib, the add-on use of Parsaclisib resulted in further splenic volume reduction and further symptom improvement and further clinical benefit in the majority of patients. These results were observed early as 4 weeks of the combination, and they seem to be persistent at 6 months of follow-up. And we look forward for more mature follow-up and more final data for future meetings to see the full benefit that patients will manifest with this therapy. The combination was safe. The majority of patients were able to maintain the combination until the primary endpoint assessment. And the discontinuation due to adverse events was very infrequent in our study. And this was a very favorable study, which resulted in additional clinical trials that are being designed and being presented in EHA as well.